us versus them. You guys are on one side and we're on the other side. It feels a little. I know. We're recording. Okay. So thank you to everybody in the audience and the task force members that are here this evening. Every meeting, I feel like our crowd gets bigger, and that's wonderful. And we also, beginning the last meeting, we have started recording these. We're not live streaming them, but we are recording them and then they're available. So if you know people that want to watch it, they can. We have Carrie Conley with our city attorney's office joining us remotely, as well as Steve Halverson is joining us remotely, one of our task force members. He was feeling a little under the weather and didn't want to make anybody feel uncomfortable if they had to sit next to him. So we said that's okay. For those of you in the audience, I'm Julia Hyduk. I'm the city manager, trying to facilitate these meetings. And a lot of you guys don't have your agenda, so I'm just going to go through. I'll go through quickly what is on the agenda for those of you that don't have it. Next up, we're going to review the status of the Phase 1 code amendments. Then we're going to do a quick summary of the outreach since the last meeting. So heads up to those of you that were at Summerfest. I'm going to ask you to chime in a little bit. And then we're going to hear from service providers. We have Melissa Bauer with the service integration team here, as well as Jimmy Jones and Ashley Hamilton from Mid-Willamette Valley Community Action. And I believe, I'm not sure if they're here yet, some folks from Recovery Outreach Community Center. I don't see them yet. They might be joining us. They said they were going to be here. We also invited Diebold Ministries, and I didn't get a confirmation if they were able to send anybody. Okay. The person I reached out to wasn't available, but he was going to see if he could get somebody to come. So we've got 3 service providers, so that's great. And then we'll take public comment, leaving a lot of time for public comment because we know there's a lot of interest, trying to leave 45 minutes for public comment, and then briefly go over next steps and adjourn. So that is what we're hoping to talk about this evening. Oh, thank you. So we do have requests for comment or requests for recognition forms at the entry of the room. If you're wanting to fill those out and bring those up here so we know how many people to plan on. If we've only got a few, and there's a lot of dialogue going on, I won't cut us short if I'm getting a lot and we have a lot of dialogue going on amongst the members. I'll probably cut us short so we can take public comments. Okay. Any questions from the task force on that? Okay. So status of the Phase 1 code amendments. I have an information sheet that has been out on the website, but I was also going to just hand it around for you to take as many as you would like. If you want to take them to your business or businesses, I would love for you to share this. Sorry, I'm going to pass that down to you. That basically goes over what the council adopted and what the regulations will be in effect beginning on Wednesday. Basically, what council did at their last meeting was adopt the camping ban for parks and public facilities. So all parks and all public facilities, I think that's what we discussed at the last meeting, but they also added hour limitations. I know we had some discussion about that at our last meeting. The council adopted limitations between the hours of 8 p.m. and 8 a.m. So on those properties that are not prohibited from camping, people can only be there between 8 p.m. and 8 a.m. And then we still have all of the other code criteria or regulations that are in force regardless of where you're at. So that's that. It's essentially in effect August 16th. And I was going to ask Chief Johns to come up. Sorry, I'm putting you on the spot. We sort of talked a little bit about this earlier today, but just what the plan from a police perspective is on enforcing the regulations beginning Wednesday, what your plan is for parks and patrolling. Where are you? Sorry. Yeah, if you want to go.
So specific to the new ordinance. Yeah. Okay.
Yeah.
So Again, we'll always address behavior. So if there's behavior issues, we're going to address those first and foremost. But if there are areas that are prohibited from the camping, then we'll address that as trespass issues. And then if it's in the areas where it's allowed, once the 8 o'clock hour arrives, if there's reports that people are there outside of those hours, of course, we're going to respond to those. And then based on what our call availability is, we would do patrols of those areas to make sure that there's not people camping outside of those hours as well. Does that answer to what you...
Questions on that?
I think there was one question.
Can you speak in the mic? I'm sorry.
I'd heard one question from a community member that they're curious if the police are going to say you can't be here, but you should go there. Or are you just going to say you can't be here?
Yeah, that's not our general practice that we, it would be, you're not allowed to be here. And, you know, whether it's because they're in a place that is prohibited or because of the hour that they're prohibited. General practice would be that we're looking for compliance to not be where they're not supposed to be and have them move on.
And I just wanted to remind the task force and inform the audience that the police already have sort of a flyer, if you will, of resources. So if they, encounter somebody that is, camping where they're not supposed to be camping, they'll inform them that they're not supposed to be there, but then also hopefully get them to resources that are, more helpful than just having them roam. We want them to know about the resources that are out there.
Right. We're generally looking at what the root issue is. If it's someone that's displaced for a little bit and needs. Okay. I think everything's projecting because it's super loud here. When I was sitting behind Julia, I couldn't hear her either. So I'm not sure where our speakers are projected to, but I think it's only to the middle. So yes, we generally look at what the root issue is and if there's a way that we can address that so that we're problem solving for continued, because we don't want to have to necessarily be continually dealing, right? And we're sure the person that's in the situation is looking for long-term as well. So if we can get them to resources, we can get them to someplace that's safe for them to be, that's a good We've driven them to placements in Salem. We deal with Sauk and Rock. And so if there's places that are going to be a good resource to them, we're always going to look to that first.
So Becky, you kind of did a good segue into what you're hearing. I wanted to have us have an opportunity for a summary of outreach that we've had since the last meeting. Sorry, I tend to be very loud, so I don't think of myself as having to project, but I'm going to be yelling now. So 4 of you were at Summerfest officially as part of our booth, and then I know several of you were at Summerfest for other reasons. I'd like to hear from those that were at the booth first, but then anybody that's been, I'd love to hear what you're hearing. Part of the being on the task force is reaching out to friends and neighbors. And so I think sharing what outreach you've done or what you've been hearing would be helpful too. So I'll start with Adam because I know that you were there.
Hi, my name is Adam, and I just want to thank all of you for being here. I think it's really important for the community involvement. The booth I thought was a great thing for people to stop and ask questions. Overall, I think there's a lot of I don't want to say misinformation or disinformation. That seems to be the new word nowadays, but more of just a confusion on what the city council is or isn't doing, what we are not doing as a task force, but a lot of interest in just what is going on. And, I'd almost say that who we talked to, it was kind of 50-50. Some people were happy with the way things are going and some people were not. And I think we're going to get that no matter what. But I think it was a great way to reach out to the community and get everyone else's opinion. No, I wouldn't say everyone else's, but a multitude of opinions. And at the end of the day, we were thanked by multiple people. And the big question was everybody wanted to know the pool hours, to be honest with you. They don't want to talk about the task force much, but yeah, no, I felt like it was a successful thing to have us there at the booth to speak with people. And I think that there's a lot of work left to be done, but I think that things are starting to go in the right direction.
And then Cassie and Trisha. Kim was also there, but she's not here this evening. She's on vacation. So Cassie or Trisha, do you want to share any additional thoughts or insights from?
Well, I was there with Adam. So we shared the same time. So I spoke with a lot of the same individuals. I'm glad that those of you that are here are present to get it from the source and to understand that we're making recommendations based on what we're hearing and doing the best to, make sure that we're doing the best for everyone in this situation.
Trisha, did you have anything to add?
Yeah, pool hours were definitely the favorite question. But the only thing I would add is just, I guess, underscoring the curiosity and wanting to learn, regardless of opinions or what they shared. I was just happy to see a lot of curiosity and wanting to know how our city and how our neighborhoods are addressing the situation. So that was really encouraging. Great.
And how about Becky, Carrie, and Ben, if you've just had any other non-officially organized outreach opportunities?
I can kind of add to what Adam said. I think mostly from what I've heard from community members has to do with misinformation getting out there on social media and having lots of questions about that. And so I try the best I can to answer those in the moment, but I appreciate you guys all being here because this is really, like they said, the best place to come get that information. But with that said, for those of you here, Adam kind of touched on this. We kind of are doing this in phases. So we're just getting started. Nothing is completely done yet. So hopefully that helps ease some anxieties out there.
Carrie, I know you've got to have a lot of opportunities to talk to people.
Well, I hear a lot of, what are you doing? We don't want these people in our backyard. You guys need to figure it out. You need to tell the council, we don't want them camping near our homes. We don't want our children near them. We don't want them in our parks. We don't want to be Salem. And I mean, yeah, that's what I'm hearing.
Yeah.
And so I'm just trying to share what we are obligated to do as a city. And I guess try to share, to have that empathetic heart, just that piece of non-judgment about why someone is unhoused, and just have a little bit of empathy as to what it's like to be unhoused. Mm-hmm. Unpopular thought, but and of course, knowing that for me personally, the best interest of our community, our families, our children, our grandchildren, our businesses are really where we're at, as well as being legal within the guidelines of what the Ninth Circuit Court has decided we have to do. It's a really hard position to be in, and so we'll do the best that we can.
Yeah. Ben?
I mean, I'll be honest, I haven't had much contact with anybody in the last few weeks. This is the time of year when I'm out of town a lot and busy doing stuff with my family. So, but I haven't had any contact, through emails or anybody from citizens. So, yeah, my exposure has been limited recently.
And then I realized I forgot, Steve, did you want to share if you've had any informal outreach opportunities with folks?
Yes, I have a few. Can you hear me okay?
Yes.
A few of my neighbors, and just to echo, a lot of misinformation, a lot of not understanding what was going on. Did my best to just present it factually to them. In fact, one of them lived near the city property by the middle school, and he was quite concerned. He had heard that was going to be taken over, and I tried to explain to him. The city council had, at the time, the city council hadn't finalized, and they would be looking at some finalization of it, and tried to explain it to him. And again, I think tried to add to them a certain amount of understanding what the unhoused population is facing, and talked a little bit about numbers. I think there's a lot of misunderstanding about numbers. And of course, we don't know exactly, but I think that's an issue too. That's about the size of my interactions in the area.
Thank you, Steve. I also have, especially after the our town newspaper article came out, I got a lot of phone calls and questions from folks, and have been listening. I think people are concerned. I think it is an opportunity for us to reach more people. We did, as a reminder, it's kind of as much for the audience as it is for you. We did the survey. We reached almost 400 people through that survey. We got a lot of input, but that's only a fraction of the city and the population, and that led us in the direction that we've kind of gone in. And now we have an opportunity with more awareness for more input. And so one of the things we'll be talking about at the end is that next step and reaching out. And just, what I've been doing is hearing and reassuring people that it's not done, that we're still taking input. We want to get it as right as we can. There's no solution. Every city, not just in Oregon, but in the nation and probably the world, are dealing with this. And so there's no simple solution, but we're going to continue as a community to do the best that we can based on the input that we're getting. Any other comments from the task force on that? I also wanted, sorry, I'm just looking at my notes. So we did Summerfest. The Our Town article got a lot of new input and interest, so that's wonderful. The fact sheet or the info sheet that I passed around, it's out in the lobby. It's up here, or no, it's not, but it will be. That has a QR code. So if people want to be added to the interested parties list, that's another way for us to get information out to people, both of these meetings, surveys, just kind of making sure that people have an opportunity to hear from the horse's mouth, if you will, kind of what's going on. So encourage people to sign up for our interested parties list. That would be wonderful. And then so Chief Johns and I went on National Night Out. The first spot that she hit, and I went along with her, was at Pine and 28th, and met with those property owners. And then we actually have a meeting scheduled for August 30th with the Maple and Evergreen neighborhood. I don't even know if she knows that. I don't think she accepted the invite yet, but we do, with the Maple and Evergreen neighborhood, to meet with them as well, just to kind of explain what's going on a little bit more. And I would love it if there's any task force members that would want to tag along on that with me. So I'll send an email out on that. August 30th, I believe it's at 6. That'd be wonderful. Thank you. Okay, if there's no more outreach summary, we'll move into hearing from service providers. And part of this was based on the last meeting. There was just discussion about, what's out there. I think there's a perception that people in our community are just homeless in our community, and there's no resources for them, and they just sort of exist there without any support to get them out of that situation. And so I met with Kim Dwyer after our last meeting, and we kind of brainstormed and discussed and thought it would be a great idea to bring a variety of resource providers in to share with you what they do and how they're doing it, and as well, how they're doing it in our community as well. So first, I'm going to ask Melissa Bauer, who was tagged by Kim, to represent this SANIAM service integration team. Kim would do this, but she's on our task force, but she's not here this week. So Melissa, would you come up here and take a seat and just kind of share what the service integration team does in our community. And then make sure your light is on your microphone and yell.
Yes, my name is Melissa Bauer. I'm the Integrated Health and Outreach Director for Santiam Hospital. And one of the programs that we operate is Santiam Service Integration, which Kim Dwyer is our coordinator for that. And she wishes she could be here, but I am here instead. And I started service integration in 2017. And so I know a little bit about it, but she has really had a lot of growth in this program since she took it over. And so do I have 5 minutes? Is that what she told me?
Yeah. About.
Okay. I will try to be as direct as possible to get through the 5 minutes, but just a little background for those that don't know what service integration is. I've passed around kind of the process and also a calendar if you'd like to come and check out a meeting. But service integration is made up of service providers, nonprofit organizations, government agencies that are at the state and county level, as well as our local Marion County Sheriff Department, and state and PD represents our North Santiam team, as well as other nonprofits, community members, and businesses. And so I'll stay with our North Santiam team, but we do have 4 different teams. They're based on the school district catchment area. So it is a relationship between Santiam Hospital and the school district. And so each team has a pot of funds that come from both of those entities. And the team for North Santiam averages around 40 in attendance, but has the program has near 200 team members. Those team members, the idea is that service integration is building relationships with other service providers. And there's a common goal to meet the community needs. And so it could be anywhere from we're helping a family with rent to avoid an eviction, or we're helping a child with a pair of shoes that a teacher has identified as needing clothing. Or it could be that we are assisting a community member who maybe went through the emergency department, and our team member there has determined that they are homeless and are needing to access services. And so with that building relationships, we also have faith-based representation. And a lot of times the request that is put into the team is resolved amongst the team members, and never do we have to access the pot of funds. And so, but when we do need to, so say I've passed around the process, but it's a team member identifies they're in need, and then they work amongst the other team members to solve that need. And then if they can't solve it amongst themselves, they then can access the funds through a funding request, and that team gets to vote on that funding request. And one of Kim's jobs is that she not only facilitates the meetings, but she also facilitates the request. And so she's making sure that there is a need that's been identified, that family or individual has been connected to the different services that are available. And she's making sure that the team members are working together to solve the problem. And through that, sometimes it might be identified that it's not a good fit for the program, but most of the times we're able to resolve the issue and that person is able to receive services. So speaking specifically to the homeless population, a lot of our partners, one is right across, Jimmy Jones and his team at Community Action Arches program. But when a community member identifies, or a community partner identifies someone who is homeless, the first thing that we do is determine through our partners at Arches, is this person connected to Arches? Have they had an assessment done? And Jimmy will go into that, what that means. But we're making sure that they're connected to services We're assisting partners in getting them to a shelter if they're willing to go to a shelter and there's a shelter available. And Kim really tries to make sure that if she can, that we can provide safe housing. And so sometimes that might look as we have someone exiting a healthcare facility and needs to have housing to recover. And so we might utilize our team funds to pay for a hotel. Arches might pay for the hotel. A church might pay for a hotel. And we get them into a hotel while we work on finding long-term solutions. So that's really the goal of service integration, is to meet the immediate need, but then work alongside that family or individual and other service providers and identify like what barriers are there to accessing long-term services and connecting them to those long-term services so they can stabilize. Are there any is that?
No, that's great. If you can make sure the task force members have a copy of what you handed out as well, if you have, and then I want to make sure I have one so I can have it from a meeting summary. Any questions, task force members of Melissa? Thank you. All right. So next up we have, thank you, Melissa. We have Jimmy Jones and Ashley Hamilton from Mid-Willamette Valley Community Action, and they actually have a presentation that they've done, and they sort of get more time because they're covering a lot of people. They're covering SOCC and Arches, and maybe has Rock come yet? No. Okay. So go ahead.
Well, good evening, everyone. I'm going to try to project as best I can. My name is Jimmy Jones. I'm the executive director of the Mid-Willamette Valley Community Action Agency. We cover Marion County, Polk County, and a few other counties in certain specific cases. If you don't know a whole lot about the history of community action, they were agencies created in the mid-1960s as part of the Economic Opportunity Act of 1964. And they were really designed to provide federal resources into local communities so that local communities could help folks exit generational poverty and break the cycle of that generational poverty from being handed down from parent to child and from one generation to the next. And that's been our historic mission for the last, nearly 60 years at this point. We've been working in Marion and Polk County since 1969 as an independent nonprofit, providing self-sufficiency services through a variety of holistic programs that are really designed to treat the whole family and children from a variety of different perspectives. So while they work to get that going, I'll tell you a little bit about some history too of this particular problem. My area of expertise is in unsheltered homelessness, and particularly designing systems that help homeless folks access resources in a community. This current homeless issue that we have now really dates to the 1960s and a lot of very poor public policy choices that were made in that generation that exacerbated a housing crisis that sort of reached its peak here in the last 20 years and created a homeless problem on a national basis that seems very almost intractable at this point. I would also add very briefly before we get into this is that, one of the most common misunderstandings about the homeless population at large is that it's a static population. It's not a static population. It's constantly changing, ever increasing. We are taking hundreds and hundreds of people out of homelessness every year, but hundreds and hundreds more are entering it. So your system should really be designed to work like a bathtub. That is, the exits at the bottom, the drain needs to make sure that more people are exiting the system than are entering because the spigot is turned on to at full volume. And when that doesn't happen, then we have situations where we end up with very large unsheltered homeless crises. So that's kind of the situation that we're in today. Our program dates, as I said, to the mid-1960s. We have 9 program areas. That slide on the board there shows 8 of those. We've broken the adult homeless program into 2 to provide a little bit more specialty of coverage between housing and sheltering. But anyway, we operate a weatherization program for help with low-income homeowners. We provide the energy assistance program in the community to help with people pay their light, gas, and water bills. We have a small reentry project out at the Marion County Jail for folks who are exiting incarceration. We run an entire division on early learning and childcare, especially a very large Head Start program, provide training and technical assistance and USDA food program for family-based childcare providers across several counties. And the subject that we're here tonight is to talk a little bit about our Arches project, which provides services for the adult homeless population. That program has grown to such a point at this point that we now have it subdivided into a housing program and a sheltering program to meet those specific needs. Ashley, if we can advance this. I'm not going to belabor many of these slides for very long. I'm going to turn this presentation over to Ashley here in just a few moments. But before we get there, I just wanted to touch on a couple of things that I think are really important in understanding how the work works, how the work is designed. From the 1980s up until around 2010, we ran a homeless system in the United States that was not very successful in reducing the number of homeless people outside. Specifically, it was sort of modeled on a treatment-first transitional housing system with heavy barriers in terms to getting into housing and shelter that required a great deal of the population. In many cases, they just were not able to engage with. So the success ratio of that old system was about 25% in terms of exiting people out of homelessness. Today, we use a system called Housing First, which has got a lot of national attention in the last few years. It has a national success rate of about 85%. That's still not 100%, but it was much more successful the last 13 years, even though it may not feel like it from watching the growth of the homeless population nationwide, than the older system, which was really exiting very, very few people from homelessness. So that system really has a number of key ideas behind it. I'll just briefly touch on each one. The first one is this concept of housing first. That is, you're going to move people into housing or shelter without expectations. You're going to move them in as quickly as you can and provide wraparound services. You're not expecting sobriety. You're not expecting changes in behavior necessarily. You're not expecting a whole lot of them at all, but it's really a straight pipeline from the streets into an apartment, for example. The other philosophy that we're very heavily invested in is harm reduction. And what I mean by that is we realize that there's a great deal of an addiction issue in the homeless population. We're not expecting folks to go cold turkey immediately. We're expecting them to do less harm to themselves. So if they're using drugs, we want them to use less drugs and eventually no drugs. But we can't create a barrier at the beginning of that project by basically saying that we expect you to stop using all substances ahead of getting any assistance. Client choice is very important to kind of housing and shelter destination that we send them to. Critical time intervention, that is, in many cases, people who are exiting from incarceration have the opportunity to get assistance first before they enter an unsheltered condition and their situation gets worse. Trauma-informed care, that's a recognition of the fact that many people who are outside are suffering from enormous traumas, from violence that has happened over the course of their lives, from economic conditions and a whole host of other things that create mental health concerns that might impact somebody's ability to get back into housing. These programs are focused on recovery over the course of the long term. We use various HUD-level systems on a national basis. One of them was called coordinated entry. And that's the idea that you don't operate on a first-come, first-served basis, but essentially you operate on a needs analysis basis. That is, the higher needs people get assistance first, just like when you go to the emergency room at the hospital. If you're having a heart attack or, something of that nature, you're going to get taken into the back a lot faster than if you just need stitches on your finger. So that's the philosophy behind coordinated entry, is to make sure that high needs folks get access to housing first. We operate a lot off this concept called the social determinants of health. That is, we believe that in order to live a healthy life, housing is one part of it, but there are a lot of other health concerns that go into that concept. Providing cost savings. We want to take folks who are creating tremendous costs for the community, whether it's in the incarceration system, whether it's at the hospital or a whole host of other places. We want to divert those costs into the community and put it into housing so that we can change the course of that cost to the community. And lastly, there are several housing types. Before I hand over to Ashley, I'd like to point out that we are heavily invested in permanent supportive housing. Is for those highest needs individuals. In many cases, those are folks who just will never be able to kind of stand on their own. They're going to need some long-term case management, long-term rental assistance, long-term supports in order to be successful. It is a very, very successful national model. We use it here locally in quite a few housing programs. For moderate needs homeless individuals, we use a rapid rehousing approach, and that just means we want to get them back into housing as quickly as possible before they become a population that really will need permanent supportive housing. Rapid rehousing programs typically last a couple of years. Diversion is simply, folks who have just become homeless for the first time. We want to get them out of that condition as quickly as possible before these traumas begin to impact our ability to get them rehoused quickly. We also run a little bit of transitional housing. That concept was wildly discredited about 20 years ago, in part because it wasn't being done well, and HUD essentially unfunded it around 2008, 2009, 2010. You are beginning to see those housing models come back now. We run quite a few of them of our own. And lastly, we also run Shelter Care Plus models. And this is the idea that we have a lot of homeless folks who are exiting from medical settings who need just a few weeks perhaps to recover from their medical condition. And we provide shelter beds from a couple of motels that we own toward that end. So I'm going to turn it over to Ashley and let her talk a little bit about the work that Arches, which is our housing and homeless program at the agency, and what it does. Thank you, Ashley.
Okay, thank you. And good evening. My name is Ashley Hamilton. I'm a Chief Program Officer with Community Action with our homeless and housing initiatives. I forewarn you that I'm a little bit of a meek speaker. So if I am not being heard, if one of the task members just give me a little bit of signal to remind me to speak up throughout this presentation. So I'm here tonight to kind of share with you the resources that are available through Community Action, and specifically through our department known as the Arches Project. We're mostly called that. That's our homeless and housing wing. We really function under 4 distinct domains, and I'm seeing now that you can't quite see them with the lighting, but what they really are is, with each little bubble there, is basic needs. So providing what people need in order to have a sustainable quality of life. So if you need food, access to a shower, laundry, some of those day-to-day things to kind of get you through to the next moment in the continuum. Our second piece is supportive services. So that's working with the individual in a more holistic way. So that can mean different things dependent on the household. Sometimes that's vocational rehabilitation, access to state or federal benefits, tenant education. What does it mean to be a tenant and work with the landlord and maximize your refundable security deposit? And because I can guarantee none of us were born knowing how to complete a housing application. I swear those get more complicated every year. So helping people navigate through that process. The third pillar is coordinated entry. And really, that's just a fancy name for the identification and the triaging of individuals experiencing homelessness or at risk of homelessness. So it's the use of a survey so we can determine not only what their needs are, but their vulnerabilities during this experience. And we can then put them into programs that are best suited to those needs. And then, of course, the last pillar, which is, of course, the answer to homelessness, which is housing. So providing a variety of housing opportunities kind of along the spectrum that Jimmy just provided, from permanent supportive housing all the way down through to shelter. Go ahead. So today I just brought a couple of key examples through the Arches Project. It's just a little snapshot of what we are able to provide, as well as some information that relates to rural Marion County and the state and sublimity area. So our day center is what most people think of when you think of downtown Salem homelessness. Arches, we're right there off of Commercial Street. It always looks a little busy, a little chaotic. And on some sense, it is designed to be that way. Your day center has to be your lowest barrier gateway access point to get people into the system. So it's really meant to meet people exactly where they are in that moment. So we have about 130,000 service transactions per year going through the day center. So it's fairly busy. Right now it is open Wednesday through Sunday from 9 a.m. to 4:30. And at the day center, people can access showers, laundry, a full set of meals, as well as case management and resource navigation into those shelter and transitional housing opportunities. So at our day center last year, we were able to provide service transactions to to the tune of 283 service transactions specifically to state and sublimity residents. Another way that we engage with your local community is through partnering with the ROC, we partner with them to operate a warming shelter. So they actually were able to open 104 nights this last year over at the Santiam Outreach Community Center facility. So they provided through that activity over 558 bed nights. And bed nights is really just a simple term for it's a person in bed per night. And so it adds up every night. We do that through a subgranting opportunity using state funds. And it's really just assuring that those warming activities are available for people when experiencing extreme weather temperatures, whether it's below 35 degrees, 32 degrees, rainy, snowy. It's kind of set by the subrecipient at that time. And we really applaud the ROC for raising that bar and being available to your community at 35 degrees.
Ashley, before you go on, I just want to acknowledge for everybody that what you're seeing up there is not what is on the slides down here. And so in your meeting summary, I'll include a copy of this. And then anybody that's on our interested parties list will also send you a meeting summary so you can read the detail in the slides a little bit better.
Yeah, I apologize for the font. I don't think I was expecting the additional light, so I'm glad it'll go out to you. Another way that we engage with your community is through outreach. So getting our teams out into the field, connecting with your community members who are experiencing houselessness. So we have two distinct teams that operate in that fashion. One is our general outreach team. So they're just going anywhere and everywhere, Marion and Polk County. They're distributing tents, tarps, assisting with transportation into shelter, assistance into housing navigation and housing assessments. So really meeting people with where they're at that given time. Our second outreach team is known as Fuerza Campesina, and they specialize in outreach targeted specifically to our agricultural community and our farm workers. So really building the relationship with that community. The farm worker community specifically are sometimes invisible in the conversation. We don't always think about that population needing tailored and specialized services. But a lot of the time, we absolutely need to come up around this community. They're very fearful in engaging with our systems. And so building that relationship out in the field so we can get them service connected has been incredibly powerful. So last year, we engaged with 586 rural Marion County residents through this process. That does include a little bit of the up north numbers, especially with the use of Fuerza Campesina, and provided over, 1,500 service transactions in the field. So a service transaction in this point would be one sleeping bag, one tent, transportation to a warming center. A great way to personally engage with your outreach services is to call us. So we're out in the state and sublimity area every Tuesday and Thursday. So we kind of alternate between morning and afternoon hours, but we do have a dedicated hotline that you can reach us during business hours. If you do call us outside that time, leave a voicemail, we will return a call back to you within 24 business hours. And that lets us know that, hey, this is an area that we need to pay attention to. This is someone in need who maybe isn't integrated into the system, and we got to pay attention. So this is a great way to collaborate. This is also allows us to service connect the individual, not only with SOC, but also with SIT, and brings them into the larger service continuum. Just want to spend a second here to highlight that second pillar. That was that supportive services piece, coming around the individual, working on benefit attainment, vocational rehabilitation, tenancy. And one of the programs I really appreciate in this space is our Veteran Service Officer program. So we operate that on behalf of Marion County, and that is for all veterans, family members of veterans who are experiencing maybe a little blip in the road with their VA benefits. And we help people not only kind of unclog that system so they can receive their ongoing payments, but it also helps retrieve their back pay benefits. So some of the most exciting stories actually come through that program. It is very common for our veterans who are experiencing housing insecurity and are rent or income burdened, and they come in looking for help, something medically service related, and come and be lo and behold, we're able to unlock thousands of dollars of ongoing monthly payments to the household, as well as tens of thousands of dollars in what they were owed in back pay benefits. And that is incredibly life-changing to that household and is able to help stabilize them moving forward. So in total, we were able to provide almost 2,000 veteran households as that service last year from rural Marion County. Go ahead. I did want to take a second to highlight the Santiam Outreach Community Center. So this is our outpost out here in the Canyon area. So it's specifically located in Mill City. The address is on Santiam Boulevard. So at that location, you can access our housing assessments, which I'll go over here in a moment, but also group classes through The Rock, who is an active and engaged partner at that location. There are mailboxes available on site. It acts as a day center for people who need to come in and just begin that process of relationship building and working into that continuum of service delivery. This is, also the service location where the warming shelters were opened through The Rock at that time. So this location is special too. It provides a critical piece of this puzzle, which is homeless prevention. As Jimmy was kind of describing with the tub analogy, there's kind of an inflow of water also into the system. So what we want to try to do is prevent homelessness, especially in our rural areas when housing stock is incredibly limited. So how can we keep people in their homes? A great way of doing that is helping with emergency rental and utility payments. So last year through the Santiam Outreach Community Center, we provided over $300,000 in that homeless prevention services to 97 families, specifically from the state and sublimity area, helping them stay in their home. Oh, that is definitely an interesting color block. It's not supposed to be there, I promise. But coordinated entry. So again, that's just a fancy word for identifying and triaging and service prioritizing people into the larger homeless system. It really is the gateway into the majority of housing opportunities, not only offered through Community Action, but also through our partners at the Mid-Willamette Valley Homeless Alliance, which is your larger continuum of care. So this process really takes place through a survey, which helps us better identify the needs and vulnerability levels of that household, helps us know what stage of homelessness are they at? Are they at risk? How long have they been experiencing unsheltered homelessness? Are they chronically homeless? It also helps us identify medical needs or risk evaluations. And we can use this information to put them into programming that is going to best suit their needs long term. What we don't want to do is put a highly vulnerable and complicated case into a program that's only going to give them 2 months of rental assistance and say, okay, good luck. They're just going to cycle right back into the homeless pipeline. And that's traumatic for everyone involved. So we want to make sure the services match what the household's needs really are. And that's what coordinated entry affords us to do. So we do these housing assessments on a referral basis. And so a provider, like one of our SIP providers, can call and refer a household in for that process. We are also we're also at Anthony Hall every third Thursday, and households can even go to the Primary Arches location there downtown, and that can be on a walk-in basis anytime Monday through Friday. Oh, sorry. Would you mind going back? The block cut me off a little bit. So one thing I did want to highlight through this process is we're able to gather a fair amount of data points on the unhoused population, not only just specifically within state and sublimity, but we can go a little more globally in all of Marion and Polk County and help us identify who is the population that we're trying to serve so we can build that evidence-based programming. And with that data set, we can hone in too. So using coordinated entry, we were able to assess last year 32 unsheltered individuals who were self-identified as Stayton and Sublimity residents. So that is a little higher than your local point in time count. And I kind of wanted to take a moment and explain why. So that point in time count is just a count of the unhoused population over a 7-day period in the dead of winter. So it has its benefits, but also its limitations in practice. And it's really hard to identify everyone who's experiencing housing insecurity within such a short time frame, especially when they're a little more hunkered down, usually due to the weather, and especially in your rural community. So what the coordinated entry process allows us to do is examine that data set, but throughout the whole year. Coordinated entry is available to us every business day, 52 weeks a year. So it really broadens that opportunity of engagement so we can get a better understanding of what the numbers in your community truly are. Now, it doesn't mean, just as Jimmy was stating, these are not static numbers. So we may have encountered 32 unsheltered individuals for coordinated entry housing assessment last year, but we probably worked with a lot of them too and moved them through the process. So that number is only as good as the day that it's drawn. So we're constantly moving through that. So just a quick couple pictures on where people go after the assessment. So one of the good example is Tanner's Project. So this is our veterans shelter and transitional housing project in Salem. So this is a 36-bed facility specific to male and female veterans and their furry companions. They can come in and stay for up to 2 years before they transition onto the next phase of life. On site, we have behavioral health services, housing navigation, case management, and peer support. And I mean, it's a wonderful facility that really creates that community living. The veterans share a couple communal kitchens, and so they cook together, they dine together. It really creates that camaraderie and that experience upon exiting service. They can kind of recreate that. That project has been open since, I believe, November of 21. And since that time, we have served 15 rural Marion County veterans who specifically identified as state and sublimity residents. Go ahead. We'll get there. Excellent. Another project, upon receiving the housing assessment and through a provider referral, sometimes through our shelter care work, we do have a couple of motels in the community action portfolio. So we have the Arches Inn and the Arches Lodge, both located in Salem. They're both 75 rooms for unsheltered individuals. Each one of them serves a little bit different population base. So the Inn has been open since, I believe it was December of 21. And that at first opened for the wildfire victims. And so we housed quite a few people in that space until we were able to work with the service integration team and disaster recovery to get people back into their community of origin. Since that time, we've been able to kind of move on to the next phase in its life. And so we're working with individuals who are exiting that medical care system. So as Jimmy spoke about, that Shelter Plus group. So we receive referrals from our regional hospitals and medical care providers, people who are experiencing some acute health conditions and maybe post-surgery, and it's just not safe for them to go back into an unsheltered state. And so we take them on. It's almost like a prescription for housing in sorts that's written by a medical provider. And we also have a little bit of just general unsheltered homelessness with referrals from our outreach team. So we come across people who are just in very dire straits and we need to get them inside. This is the place where we can put them. That second hotel there on the bottom, it's a little bit of a fuzzy picture, but that is the Lodge. That is a soon to open hotel. That's a recent acquisition under the Community Action portfolio. And that will house some of our general population work as well as some overflow with those veterans. On-site at both facilities, we have case management, peer support, mental health services, and even an on-site healthcare provider with JD Health and Wellness. All right, that looks like that's a summary. So I look forward to being able to share the slides with you in full so you can get a little better context of what was presented here today. And I think we'll go ahead and take a little bit of questions, maybe.
Yeah. Do you guys have any questions?
Do you guys do any type of statistics as to like finding out why people are becoming homeless? Is that part of what you do? Is it, addiction? Is it financial irresponsibility? What is it that is causing it? Do you guys do any of that?
So if you look at the total statistics across the United States, louder. Okay. Thank you. If you look at the total statistics across the country right now, the homeless problem is really on the coast. And so what is unique about the coast compared to the rest of the country? And it's simply housing cost more than anything else. So almost everybody on the West Coast that's entering into a condition of homelessness is entering because of economic reasons. Now, they may have many other issues that go along with making it very difficult to exit homelessness after they've been outside for a while. There is some correlation as well to the decline of the state hospital system in the United States. You look at the Community Mental Health Act of 1963, also the lack of general financial support for public housing that was devastated in the United States in the 1980s. There's some correlation with the decline in services and the lack of state hospitals in particular. But primarily, the best answer to your question is that it's almost always financial, and it's almost always because somebody lost a job, got injured, went to jail, got a divorce, just couldn't afford rent anymore.
I'll follow the rules. I'll put my little name tag up.
Thank you. I noticed that.
Can you guys talk a little bit about the movement of those experiencing homelessness, resident versus transient? Where do they come from? Where do they go? And specifically in our region here.
So one of the great big questions in homeless services, and especially in terms of public policy and for the community at large, is where are these folks coming from? And there's a narrative that builds over time that they're being shipped in here or transported here from some other location. So many years ago, around 6 or 7 years ago, when we created a program in the city of Salem called the Homeless Rental Assistance Program, we sort of designed the entry pieces to that, and the Housing Authority ran that. So I sort of anticipated that this issue would come up. So we began to track the point of origin for every homeless individual that entered that system. And what we found out in the end is, yes, there are some folks coming here from Portland. Yes, there are some from California, but 80% of the folks that we interacted with were from this community, that they had lived in Marion or Polk County at least 10 years. And they had become homeless in Marion and Polk County, and they have stayed in the region, not necessarily because there are more services, but because that's where their family and friends are located. And the only sort of lifeline that they have to that life is to remain close. So it's very easy to say that somewhere about 85% are local.
And I think the only small piece I'll add to that is during the housing assessment process, when we're talking about their community of origin, a lot of that client choice principle does fall into there. So if they are self-identifying as State and Sublimity or Salem Kaiser, that's because that's their community that they believe they are a part of. So they do get to choose. And so that tells us when I see 32 unsheltered individuals have gone through the process in the last year, that means they claimed this community. This was their community prior to homelessness, during homelessness, and hopefully into the future as well.
Adam, good job using your placard.
One of the comments that I get a lot of times from people that don't want to help is it seems to be a large thing where people think that sex offenders are a large majority of the homeless. Is that a true statement, or is that not true?
Not at all. Statistically, around 4 to 5% of the population, street population that we work with, not necessarily the full homeless population, including all the people who are housing unstable and things of that nature, but generally somewhere around 4 to 5%. It's vacillated upward to 6 at some times of the street homeless population in Salem have some history with those particular charges. So 95% simply do not.
This is going to be the Adam and Tricia show, apparently. Tricia, go ahead.
Join the club. I know you guys aren't shy either in your questions. What are your guys' thoughts or any words that you have on time limited camping bans or services in general? One of the things our community is talking about is having a 72-hour rule before you have to move on. And then the city council did go ahead and approve and vote in the no camping during the daytime. And so based on your guys' years of experience and thousands helped, can you share some insight on that?
It's a question I get asked frequently. And I will lead by saying that quite frankly, I think it's possible to design services that are appropriate for the community. The issues in Salem are a little bit different than the issues in Staten and Silverton and other places. That said, I've worked in a lot of big urban areas where there were some very strict time-limited expectations. And it really it's ultimately sometimes self-defeating, because if you tell folks that you can't stay here, but you can't tell them where they can go, they're just going to go anywhere. So back in the day when there was a very large homeless population on the Springwater Trail there in eastern Portland out to Gresham, the city of Portland, in its infinite wisdom, decided that it was going to police everybody off of the Springwater corridor and suddenly pretend that those folks were just going to disappear. Well, it didn't really happen that way. They drifted off the Springwater corridor and they ended up camping in people's backyards and in their, the garages and sheds and all spread throughout residential areas. So there is a driving phenomenon at work when you decide that, we're basically going to push the homeless population out of the very few places that they can stay. A lot of times that backfires on communities because they just end up in places that you didn't anticipate that they might go. That's not necessarily a reason to work in such ways to prevent areas that, might be less appropriate for the homeless population to be camping in, like near schools and things of that nature. But at the same time, I just don't want to leave anybody with the impression that these sorts of ordinances have a long history of being successful, because in many cases they have not.
I guess the only piece to add to that, and I'm not even sure how supplemental it is, but a lot of our unhoused neighbors have possessions, just like you and I have possessions, and they're meaningful to that person. Whether or not we find meaning in them or not is almost invalid. They are carrying these possessions with them either out of familial ties, personal relationships. They need it for their basic needs to live and survive. It's important. And we find with the unsheltered population, it's difficult to consistently move with these items time and time again, especially if you are compromised with any sort of mobility concern or medical health concern. So it can be difficult. A time-bound issue can say they can't be in a space, but they may physically be unable to move and take their belongings with them. And that can be a pretty traumatic process. However, that being said, I really advocate just for additional resources for people to be able to keep and maintain their possessions safely. There's a lot of success that we've had in Arches around the little safety lock boxes through our organization. So if people do have to move, whether it's for time-bound reasons or accessing services, like going to a doctor's appointment, they are able to keep those possessions safe during that time.
Just a couple of more quick points to that question. And I'm beating up on Portland in part because they deserve it. The city this winter essentially forbade their street outreach teams from handing out tents in the middle of winter, arguing that the warming centers were open and that those clients could access a warming center in Portland. Well, that sounds okay, but then when you realize that you have substantial numbers of disabled folks who can struggle to walk 100 yards, much less a quarter mile or 2 miles to a warming center, then basically they have no access to those facilities. And I've seen this happen over and over again. And the last thing I would say to that is that part of the difficulty people have engaging with services and accepting offers for help and a willingness to enter shelters in particular is that their trauma levels have been so elevated over the course of time, both by broken promises that people like me come along and say, I'm going to provide you housing, I'm going to get you assistance, but also just from the fact that, just think about it, if you had to constantly pack up everything that you own on a daily basis, shove it into a shopping cart, push it a few hundred yards, unpack it, and then go through that whole process again. Your mental health is so damaged over the course of weeks and months of that particular activity that you are very disinclined to believe anybody who comes along offering help and providing resources. So sometimes it can actually act as a barrier to folks getting assistance.
Adam.
Another question I had was when we were having some of our informational meetings, it came up of what the other cities around have done with their regulations. Some were very stipulated, some were more laxed. Would you say that there's more success with the clearly stipulated actions, or do you think that more of a laxed approach works better in your experience?
That's an excellent question. I think the city of Salem's current approach is better than their previous approach. Their previous approach in 2019 was essentially to ban all tent camping in Salem. And what that earned them was a couple hundred people, 150 to 200 people camping out under the eaves at Rite Aid because they couldn't put up a tent in a park well out of eyesight of everyone. So the more successful practice is to police these issues on an as needed basis. That is, it's complaint driven. So when something becomes a problem because the community is complaining about it, neighbors and residents are complaining about it, then it gets addressed. If you are chasing categoricals, just essentially saying, you can't be in this particular location, I don't know where you can go, figure it out on your own. And that's a blanket policy that's applied 24/7, 365. That's been far less successful in my experience.
Any other questions? We've got about an hour, well, less than an hour for public comments. Ben.
Sorry, I was trying to formulate as I normally do. So I'm pretty impressed with your extensiveness of your services and all the different things you can offer to the community. What would you say are your biggest barriers? You talked about our nationwide lack of housing supply, but as an organization, what would help you become even more effective, be it funding or staffing or things that more volunteers? What would help you the most?
As you can sort of imagine from the presentation we've given, and this was just the nature of our services that are really geared toward rural environments and rural communities. This is a very expensive operation. We are funded from a variety of state, federal, and local and private foundation resources. But I wouldn't say that money has been our chief barrier. In fact, it hasn't been much of a barrier in recent years as this issue has become such a priority for so many people across the country. I would say the biggest barrier in a lot of ways isn't anything that just naturally comes to mind, like the lack of affordable housing. There's a big one. Lack of substance abuse treatment that is residential and long-term. That's a big one. Lack of a state hospital system that can take some of the folks who are clearly incapable of taking care of themselves. That's a big one. But I think, in a lot of ways, the biggest enemy in this is our own sense of frustration, and our biggest enemy is our own sense that this is a futile effort. Because, this is a great country. We've accomplished so much. It's the wealthiest, most powerful country that ever existed. And the level of technological accomplishment in my lifetime, I was born in 1968 to now, is just so extraordinary. It's hard to sit here and describe it. I believe that we're capable of solving, a homeless crisis in Marion and Polk County, where we have about 2,500 total people probably outside at any one time. I think it is well within our ability to solve. I think we have to expect more of ourselves and others, expect more of our government, expect more of the nonprofit community who is really pushing to try to get this work done, but also to look within ourselves and say how can we contribute, not necessarily financially, but show up at meetings like this and say it's intolerable for our citizens to be living in this depth and degree of poverty, and it is incumbent upon us to create a better world so that we don't have to tolerate it. And believe that one day it can be solved.
Okay. I'll just add a little bit to that. Jimmy's quite the orator, and so he definitely provides that level of inspiration, but I'll provide you an answer maybe a little more granular. I would love to see, especially for rural communities, whether it's state and sublimity, out into our partners in Polk County, up in Woodburn, I'd like to see more opportunities geared towards permanent supportive housing. What we do know in our communities is we have an incredibly elevated chronic homeless rate. So that are individuals who have been outside for an extensive period of time. They have repeated episodes of homelessness. And as a result, they have comorbidities that make them incredibly vulnerable. So that could be active mental health concerns, chronic health conditions, in and out of treatment, dealing with addiction concerns. And so they've come to this point in their life that really talking about true self-sufficiency, the way that you and I may live it and see it, is not a dream that is necessarily attainable in a really short time frame for them. We have let this situation as a community go on for so long. And I talk about community meaning your larger institutions, state, federal. We've let this go on for so long that they've fallen through the cracks, and they need interventions that are long-term and pretty intensive. So we're seeing a lot of success in Salem, and these are newer coming to our community, but Redwood Crossings and soon to be the development of Sequoia Crossings. Those are permanent supportive housing units. They look like any other apartment, quite modern, very nice. But inside they are housing the chronically homeless. People have been outside for decades at times and just incredibly sick human beings. And with that, we pair that with on-site services that are there 24/7 to guide them back into life. There is an opportunity to graduate from those facilities into a voucher through your local housing authority and move into what we'd consider a more traditional residential setting. But you drive by those apartment buildings and you wouldn't even guess it. That's who they're serving and what they're doing. And I would really love to see the installation of those programs in our rural communities specifically, because I think they would blend in with the service model, the community mindset, and kind of hit towards what we're seeing in terms of those elevated need rates.
Okay. Any other questions? I would love it if you guys would just stay up here through public comments, because there very well could be some sure. Questions. So right now I only have 2 comment forms. There's a whole room full of people. So I am guessing there are more people that want to speak than 2. Is that, if you do want to speak, can you raise your hand just so I can get a sense? Okay. I know. Okay, so if you, the person in the back that raised their hand, if you can fill out one of these forms, that's helpful for us to know how much time to give you. If we have 20, we might limit you. If we have 4, we'll probably have a little bit more dialogue. So I'm going to let that settle in for a moment. I'm seeing some more people get up. Because you took the time to come out here. We want to make sure that you get heard and that you feel good about where we're at, or as good as you can. Becky, did you have something you wanted to say?
I just really want to encourage you guys not to be afraid to speak up. We love hearing from the community. That's why we're here. That's what we were asked to do. So it doesn't have to be super formal.
So with that, we'll give it a little bit more time. We'll go Ruth Clarkson, and then I'm going to ask you to come up and sit in one of these chairs and speak into the microphone so everybody can hear you. Is your light on? It is.
Yes,
on.
it is.
Okay, perfect. And then speak into the mic.
Okay. My name is Ruth Clarkson, and my son has property on West Maple Street. And the reason I came, he was unavailable tonight, but we would like to know if all of the different. Oh, okay. I will. Okay. All of the different sites that were listed in the Our Town newsletter, we were wondering, is the city going to post a sign and say, okay, this is a place where you can park? And we just wanted to know if that's the way people will know where they can go.
You want me to answer? So that was not the intent. The intent was, these are not, and I know that there's a lot of people in the public that think that these are sanctioned campsites. We don't really want to necessarily advertise. They're not a homeless camp that we're sanctioning and saying this is where we want you to locate. So the intent was not that we were going to post anything. Through input and feedback, there is a very good likelihood that I will ask for some sort of identification for property owners to know where their property is versus this property, so that if there are trespass issues, they feel more comfortable and confident in calling that in. But that's where it's still a little bit of a work in progress, and we're not done yet. But that was not the plan, to post anything on site to say this is where it's at. But more know that it's available in the event that there is a need. We can share with people if there aren't. If the other avenues haven't worked in terms of, getting them to resources and other things. Okay. Go ahead, Becky.
So I saw a picture of the Our Town because I very rarely actually read it. And I was very surprised at what it said. To be honest, that is not at all what the task force or the city council has agreed upon at this point. We have not said that the homeless will be allowed anywhere. What we have said is that they cannot be in the parks or on city facilities. That did leave, I think it was 8 or 9 pieces of land within city property that are not restricted. That doesn't mean we're saying go there. It just means we haven't finished the process yet. The way that the Our Town read is it made it look like we had decided that we were sending them to 28th and Pine and West Maple. So that is not our intent at this point. I don't think it ever is, but I can just speak for myself right now. So I see a lot of people out here that I know live in those areas. We are not going to, like Chief John said earlier, they're not going to tell a homeless person, go here at this point. They're just going to say, you can't be at this location. So hopefully that eases some fears. That's what Our Town said is not what we intended at this point. So,
and again, it's a work in progress.
Okay. Thank you very much. I appreciate that.
John Fedrick.
Hello, can you hear me?
Yes.
I'm John Frederick. I live on Pine Street. Lived there for about 30 years. I was a member of the Planning Commission back in the 90s for a short time. Also was involved with a community group that prevented a gravel operation on the hill on the south side of Pine Street. And I spent a lot of time walking out there in those fields and stuff with my dog and stuff. So I'm pretty familiar with the land. There's a big strip at the end of the first field that runs north and south over to the highway and down to, I think Mr. Faust owned it originally, down to the street below the south of the hill. As I remember it, on the Planning Commission and working with the gravel pit operation, that was dedicated for I think it was some kind of a trail system for a future Staten, set aside for future trails to and around Staten. So I don't know if that's part of this undeveloped city property that we're not supposed to allow people to sleep and rest on. But that was one point that I wanted to bring up, that if that's the case, it may not be a good location for what we're thinking about there. The other thing is, the last 60 years or so, that hill, the whole east end of that hill.
Can you lean forward and continue speaking to the mic? Pardon? I just was asking you to lean forward and continue.
The east end of that hill for the last 50 or 60 years has been pretty much low density housing. And there's a lot of nice homes with children and families that live along that hill. And it's traditionally, over the years, as new developments have been added, they've sustained that type of living up there. And so to all of a sudden, a homeless situation right at the end of Pine Street on a 40-foot wide strip of land that's basically a forest with logs and tree limbs and poison oak and blackberries, and it's not really habitable. And the only access to food and clothing is probably at least a half a mile down the hill and back up the hill. So it's not really very practical for resting. It's more hard work, I think. And I just don't think it's a very good idea. And so I'm not looking forward to having that happen. So basically that's what I had to say. Thank you.
Thank you. Bob Parsons. Okay. Rob Jackson.
Hi. So I live in the Evergreen neighborhood. I'm Braden's neighbor, Ruth, that's her son. And so when he showed me the paper, it was kind of surprising because the only city lot in that area is his driveway, like where he parks his rigs, where his family has been using a driveway for 60, 70 years. And it just doesn't seem right that you would make that. I know it's not a designated area, but it's in the paper. They said it was an area.
It's not what we recommend.
But it is legal for somebody to now camp in his driveway. No?
No.
So I'll clarify. I mean, if his driveway is on city property,
it is.
That's a separate issue potentially. Chances are somebody who is looking for a place to sleep is not going to sleep in the middle of a road and on someone's driveway. And they will probably find another location that is more suitable and allowed at the same time.
It seems like what you're doing, though, is I know why you don't want people in the parks. Nobody wants to see that. I've seen people defecating in the dog park. I've talked to people who are clearly mentally deranged and having hallucinations in the park. I've been threatened. I've been cursed at. So there's a problem with people in the parks, but then to say you can move them into the neighborhoods, so when they're in the parks, you have a small impact on a lot of people, but now you're going to create a big impact on a few people. And that's the people who are here today because their addresses are in the paper as a designated homeless site. That's all.
Can I respond to that?
Yeah, go ahead.
Again, I don't think any of us know who wrote that in our town or where that information came from, but that is, I mean, you can hear it from the horse's mouth right now. That is not our plan. That is not how it is intended to go. We have said, we've been meeting now since February, I believe. And we have all said from the beginning, this is even prior to hearing the community's very loud voice, that we don't want them near the schools, the parks, or a residential area.
I think you'd be better off just taking one park and saying, this is a safe
But which
place.
park? Because that's somebody's neighborhood.
Park.
That's somebody's neighborhood.
Riverfront Park.
So I'll say that was part of the original recommendation. It was decided that to take that out of the recommendation, and I think at council, I think that at the council level, because of the accessibility and concerns of fires and the concerns of accessing, in the event of an emergency. What I will say is there are probably better locations, and certainly as these sites have been, looked at a little bit more closely and analyzed, it's easy to find flaws in them. And as we go through this process, we hopefully will hone in on some areas and locations that are absolutely not suitable and see some areas that are more suitable. But it's critical to get input. The task force and the council made that first iteration based on the feedback and information that they had at the time. As we get more feedback and information, we're able to refine that based on that additional input. Carrie, go ahead.
Let me just say that I do believe that maybe the Our Town writer was quoting undeveloped right-of-ways within the city as a whole that we all looked at. And keep in mind, we are just given the information. The city council is the final deciding. We are just a group of residents who feel just like you, just like everyone in this room, that are doing our due diligence as citizens who live here to get all the information that we can and share it with our council so that they can make the best decision. We are not decision makers. We are just regular people that are going to share that with our council and cross our fingers that they hear us. I have a family member that lives on that street. I know exactly where you're at. And no way am I going to say to our city council, send them over there.
Well, the explanation that you're just not going to tell them where to go doesn't really,
well, right now
it doesn't ring true because it was in the Our Town paper. They know where to go.
Okay, here, I'm going to just take a minute and say that not everything you read is true. Like it's not.
So they're not allowed to camp there. They can't.
So
camp
technically, there? Rob, the answer to your question is at this moment, yes, they could.
Yes. Okay.
Because the way it is written is that they have the ability to camp from 8 p.m. to 8 a.m. on any unused city properties, undeveloped city properties. Is that how we intend to leave it?
In the neighborhoods.
There's
other properties.
There are. You're right to have some frustrations in here. I don't want you to think we don't understand that. We're just trying to make it clear that the decision that was made right now was
by the council.
We had a deadline imposed on us of July 1st. So we had to get something on the books. The city, the city had to do something. Well, I mean, we're all part of Staten, right? We had to. It's our duty as citizens.
But you didn't talk to anybody first.
Oh yeah, we have. We've been meeting since February.
Yeah, it came as a surprise to everybody else. You guys.
I don't know. I mean, social media, it's been out there. We've been at city events. I mean, I understand
how that announced we were doing these meetings. I mean,
I live in a park neighborhood, and I've definitely. Cassie, can you speak into the microphone if you're going to?
Just real quick, I've paid Our Town thousands of dollars for advertising, and they don't get it right. So I just want to throw that out there.
I know that I live in the Pioneer Park neighborhood, and I certainly have tried to talk with my neighbors about this as well. But I mean, we're simply here to make recommendations. Whether or not the city council does exactly what we say, those are the individuals that we all elected, and so that hopefully they're representing your wishes as well.
So. Yeah, and we'll let, I see Ben put his placard up as a city councilor.
Okay. Thanks for listening.
But Ben, did you want to say something?
Yeah, just to defend myself and the councils, just as the one member that's here today. We understand that there is no perfect solution. There is no solution that's going to make every single person happy or completely solve the problem. And the five of us on the council don't agree all the time on what's the best solution or where, what the least bad solution is going to be. I think we all are in agreement, however, that if what we do ends up pushing the homeless population into residential areas, that's the last thing we want. All of us, I'm sure. So, but we're trying to find an effective policy to address the situations without doing that. So, and become in compliance with state law. And so that we're kind of juggling a couple different things there. And also that every solution that we've kind of come up with, they all have downsides and they all have bad outcomes that could occur potentially. So it's hard. It's tough to find what the least bad thing is, but it's definitely a moving target and something that we're continually working on. So, and trust me, we know we understand those concerns about, somebody pitching their tent in your driveway or somebody else's backyard. And we definitely don't want that to happen. So we're going to do our best within those parameters. And we're still trying to figure out what that best thing is. So that's what
and I'll chime in as city manager and one, defend a few things, but also make a commitment. So as far as notice, this is a citywide effort. So yes, we did not send individual mailed notice to people, but we did have information about the task force in the utility bill months ago. We had information about the survey in the utility bill months ago. We've had notice on social media and the city's webpage. Algorithms do what they're going to do, but I know it's been shared out to a lot of people. Really, I feel like the best way to make sure that you get information is by being on the interested parties list, because then it will go directly to you, assuming you don't have us in your junk folder. So that's another avenue, and we will continue to get better. The more it's talked about, the more people know about it. So I'm sorry that you didn't know earlier, but it wasn't for lack of trying. The more information we get out, the better. And the commitment is where we're at right now is where we're at. We will continue meeting over the next several months to however long it really takes to kind of get it better, get it right. And my commitment is that if in the interim things are untenable, we will address it more quickly than going through a task force process. So, speak up. If there are problems in your neighborhood, let us know, and we will figure out how to address it as quickly as we can. So.
Thank you.
Mm-hmm.
And I just want to thank you for speaking, Rob, and to let you know, like, for instance, Becky here has all three names that have came up to speak and what the issue was. And so what she'll do is she'll take that and give that to the city council. We are basically just a microphone and recorder, if you want to, for lack of a better term. We are just here to listen to the concerns and relay those concerns to the city council. And what they do with them is kind of out of our control. But I definitely understand your concern, and everything you're saying right now will definitely go to, well, it's getting to city council through one council member, but we'll also go there through us as well. So we're definitely hearing you. And I just think the biggest thing for everybody to understand is none of this is set in stone, and it's just a work in progress. It's just trying to find what's going to work. At the end of the day, is everybody going to be happy? The future can only tell, but at the same time, we're working towards recommendations for the council that come straight from the community. And that's why I was thanking folks in the beginning of the meeting for being here, because without you here, we don't really know what the concerns are, and what is important to you might be a little bit different than what's important to the person sitting over here or over there. So it's nice for the people that come up to speak. Then we got a clear message from you and where you live and kind of what that piece of property is. And it's written down, and that can go on further from here. So thanks for speaking.
And I'll also add, so on the forms for request for recognition, you put your email. If you put your email address, you will be added to the interested parties list, whether you want to or not. After each meeting, we prepare a meeting summary that summarizes the comments that were received. That's packaged into a PDF, sent out to the task force members. It will be sent out to the interested parties list, and it will be posted on the website. So lots of opportunities for people's comments to be shared amongst ultimately the decision makers. Okay, John Lindbeck.
Greetings. My name is John Lindbeck. I live at 3 Norblad Lane. And I just wanted to talk to you about that piece of city-owned property that's right off of our neighborhood, and why I think it's a really terrible place to allow homeless encampment. I know that nothing's been set in stone. That message has been clear tonight. But I also know that if we don't speak up, later we'll get told we didn't hear from you. Now you're hearing from me. This is really a terrible idea. And thank you. That piece of land is, I don't know, have you guys looked at the map of that land?
Is it at the corner of
It's at the corner of Maple and Evergreen. And Norblad Lane is a gravel road that trails off that corner into some woods, and there are 6 houses back there. Our road to our neighborhood is a private road. We maintain that. It is not city-owned. The city has never put any money into maintaining that road. And part of the access to that property would be over our private road. And the private road crosses across the middle of one section of an area that would be allowed for camping. That to me is not a tenable situation. And the neighborhood has posted all kinds of no trespassing signs to go beyond that. This property also borders a significant piece of land owned by the Santiam Water Control District. And there is no way to tell, if you look at it now, what is city of Staten land and what is water district land. So one question I would have and hope you would pursue if you haven't already is the water district ready to allow people who may not know which is city land and water district land? Is the water district willing to assume the liability of allowing the homeless to camp on their land? So those are 2 obvious problems. Because this road is the only access to our neighborhood. And the thought for folks in our neighborhood of having a homeless encampment right outside the neighborhood that somebody, we would have to drive through that. If we wanted to sell our house, people would be driving through that to get to our house. It's my view if this piece of land was allowed, our property values would tank. So I wanted to pass that along because I don't want you to ever say you didn't hear from me, and you'll probably hear from me more than once. But I want to thank you all for the work that you're doing because I know it's a thankless task. So thank you. So it's not completely thankless. I know it's a tough job. I just know in my heart that this is not a good idea, allowing homeless encampments on this particular piece of property.
Thank you. Cassie, did you have a?
If you were speaking, the home values is something that I have actually been speaking of this last week. And
Cassie, can you speak into the microphone?
So I was thanking him for speaking, first of all, but the home values is something that I myself have thought of as far as, some of these proposed sites as well. I'm not a homeowner, but I have lived in this community for a few years. And everyone that lives around me are homeowners. And so that is something that that I have been thinking of as well with some of these proposed areas. And so with, that your information, that is something for us to continue to think about as well for these proposed sites.
I think that the Our Town article, which is where I first learned about it, it did sound more definitive in that article than what you folks are reporting tonight. I hope that you'll do something to help clear up that misinformation that was printed.
I just pulled up what you're speaking of, and I can completely see what you're saying. That's, I'm on X app, so it tells me property owners and where state and land, and I see what you're saying.
Everybody that lives in our little neighborhood has been exchanging texts about this. We're all obviously very concerned. And it does sound like the city council approved these 3 pieces of land for homeless encampment, the way it's printed in there.
I know.
So if that's not the case.
And I will say the mayor did send an email to, and I think, yes, he's behind me. He sent an email to the writer of that article, informing him of his inaccuracy in that. they are available, but they were not designated. And like I said to the previous gentleman, I think while it's available, a road in the middle of the property is probably not going to be where someone camps because of exactly what you're talking about.
Well, I wouldn't assume that based on what I've seen of homeless encampments in other places.
Again, not an encampment, a place where people can be from 8 to 8 without being removed. But again, we're going to continue to refine it and work on it. I think the feedback that's been received I think is really helpful and will help guide the public outreach and refinement in this next phase immensely.
I have one last question, and that was based on the police chief's presentation tonight. 8 to 8. So does that mean if I'm homeless and I set up a place to camp on this piece of property or any of the other designated pieces of property, and I'm not supposed to be there from 8 in the morning until 8 at night, can I still leave my stuff there?
No.
Does it say that in the ordinance? Does it specifically prohibit that?
It doesn't specifically prohibit that, but I would
think if they
essentially you're leaving your stuff and it could potentially be removed. I think that is something that we will again have to explore how we deal with that. I mean, I think comments about lockers, I don't know. That's a good question of how we would deal with that. But the expectation is that that things are packed up and moved with them rather than staying on that site.
I in a past life was the director of a state agency that was forced to, or required, it was part of our job to enforce state law. And when the law wasn't specific, that's where all the problems came in. So I encourage you to, and the city council, to be as specific as possible on issues like this, because if you're not, then we'll see what we see when we drive to the airport in Portland with these homeless encampments along the highway, that some are, the stuff is there all day long. And they turn into, there's large amounts of trash. It's the kind of stuff that could tank our property values. So thank you for listening, and thank you for doing this thankless job. So I don't want you to say nobody thank you. I did. Thank you.
Becky, did you have a comment?
I do. I just wanted to say, because it's 2 people in a row now, and I'll speak for myself on this, but it's hard not to feel defensive. I just want to apologize that we come across that way. I did this after the last meeting too, because we are all the same as you guys. We are part of this community. Yeah. I'm a homeowner too. I've raised my kids here. And this means a lot to all of us. And I can speak for myself again. I volunteered to do this because I wanted to make sure everybody's voices were heard. Yeah. So as defensive as we might sound, we do appreciate you guys coming. And also, I feel like we're kind of ragging on the city council a little bit. So I just wanted to say that they are on the same page we are. They're trying their hardest to make sure that this is going to work for everybody.
Right.
So
thank you.
And as far as the article in the Our Town, at the end of the day, it's media. I don't really know what else to say. The news isn't always correct. So I definitely don't want to badmouth the Our Town paper editors. But it sounds like in this situation, it was not actually the correct information.
Well, I would actually like to thank them because they woke up our neighborhood.
Yeah, we built it.
Okay.
Well, I will say it. I mean, certainly a lot more people know what we're doing now, and that's fantastic. And as you were talking about the texts among your neighbors, I'm like, community engagement through the homeless task force. It's wonderful.
Julia, I'd also like to thank you. We had a phone conversation one day. I relayed these things to her. She was very understanding, very helpful, encouraged me to come. And I think our city's in good hands. So
thank you. Oh. You guys will all get $1 at the door. Okay, so last but not least, and maybe not last, if anybody chimes in after this, Bob Parsons.
How's everybody doing tonight? Better now? Good. I'm sorry you guys haven't been involved with all the meetings, and I may put myself on the spot tonight, and I may put some other people on the spot tonight. But for those of you that don't know me, I've been a member of this community since 1971. Graduated high school here. My kids graduated high school here, have businesses in this area. I work for the city as the park maintenance operator. I'm highly frustrated with everything that's going on. I deal with it more than anybody, except for maybe Chief. And this morning, because I knew this meeting was coming about, my employee and I went out and took our survey of where the homeless were at. And some of them have still been in the same position for over a month. And we have tried to get people to come out here and help them get out of the situation they're in. It no avail. Nothing's gotten any better. Some of these people have been homeless in this community for the last, I'd say, 5 years. It wasn't really prevalent in the beginning, but it is increasingly getting even more prevalent. Unfortunately, yes, we've put the cart in front of the horse by passing this law and not having a designated area for them to go to. So I think as a community, we all need to rally around each other. I get tired of it too, because they've been in my neighborhood too. I live over in the Westtown area and right behind the Mormon church. And you don't know how many people I've called on, said, hey, I'll go out there and talk to them. Say, hey, what's your business here? I know the Mormons don't really want you in the parking lot. I don't know how to solve the problem. I've called these people and the Rock people, trying to get them out there. I never hear anything back from them. Sorry, but that's the way the cookie crumbles, I guess. I would love to come up with a solution. And so far, I don't see a whole lot going on, because the last month they've all been down at Pioneer and they're all out there in Riverfront Park, where I'm trying to keep them out of, because I'm afraid they're going to burn this town down like Maui, Hawaii. So those are my concerns once again. And we put too much into this community to let this whole country, for that matter, for it to continue on the way it's going. We need to find a solution to the problem. I don't know what it is. I'm trying my hardest, but we need everybody to do something. But I don't think also giving them a hand out is a solution. A hand up, probably. A hand out, it'll be like maybe 150, 200 years ago. So once again, those are my concerns. I would like to, just wish us all luck.
So I want to remind some and inform others that because we didn't have anything on the books that didn't prohibit it everywhere, because of case law and state law, we were not enforcing it anywhere. By having provisions on the books that allow, that don't prohibit it everywhere, we will be able to be more active in enforcing it in parks. And so when Bob is saying it's, some people he's seen in same places for months, or a month, it will be easier for the police to enforce that. But I will also say, like he said, the police can only see and do so much. And Bob, I'm not saying you because I know you report, when you see things, but it's important for people to not assume that the police or Public Works or whomever know where everybody is and know everything. So if you see a concern, whatever it is, either call police non-emergency. You can send if it's not a police related matter, you can send something through the city website, through the comments, to let us know of things that you see, and then we can try to respond and address that. But again, until this takes effect, which will be in a few days, they have not been enforcing it. So I just wanted to make sure people know there hopefully will be a difference in what people see, in the parks in the near future, but we'll see. Adam,
there is some abandoned sites out there at the Riverfront Park that need cleaning up.
Okay, and that is something that the city has to organize. I'm not speaking to Bob; he knows this, but the public coordinate. We have to post the sites. And then coordinate with police and Public Works, get dumpsters. It's a process to get those sites cleaned up, but we do have the ability to do that. Adam, did you have a comment?
Questions, anyone? No. Questions, anyone?
So we've got about 10 more minutes. If there's nobody else that is, there's some, we got one. And then I do want to reserve 5 minutes for next steps. So
good evening, everyone. I was not prepared to speak tonight, and I am not representing any organization. My name is Danny Freitag. I'm newer to the community, but I grew up in Jefferson, so I'm quite familiar, and I've worked for this community for over 6 years now. I just want to come here with an open mind, and I'm new to the dialogue. I've been trying to follow along. Most of the information comes from one source. But my concern and issue is that I keep hearing these people, and these are individuals. And I think that's where we're losing track. I'm hearing that we are going to be enforcing where these people cannot camp, but we're not going to tell them where to go. So now we're telling these individuals who don't have phones, don't have internet access, are identified as those that need and lack resources. Some of these have very serious mental issues that we deal with frequently and aren't able to care for themselves. What I'm hearing is that we're going to tell them to move on and that they can't camp here, but we're not going to tell them where they can move to. They don't know where public versus private land is. They don't have access to that information. What we're trying to get them to do is circle around the town until maybe they get to Maple and Evergreen, maybe they end up on Pine Street, or maybe they end up in somebody's driveway. These people also need help. Until we stop complaining about where we find the right place, they're going to end up in undeveloped land that happens to be owned by the city, but only for 12 hours. Then these individuals will need guidance as to where they can go for the next 12 hours with all of their worldly possessions. I am not someone that usually advocates for something like this. My home is by the middle school. There's a piece of land that's being considered there, and I'm pretty passionate about where we designate, but we're not telling them on Wednesday when this law or ordinance goes into place where they can go. We'll just tell them where they can't. So I strongly encourage you to recommend to the council where they can go. Thank you.
Trisha?
Dan, is that what your name? Correct? Danny? Okay. We need to be BFFs. Thank you for your words. I echo those comments and have been since February that this is a balance. We need a balanced solution. And these people are our neighbors. It's not us versus them. This isn't us situation. We are Canyon Strong, and these are part of our community. And the language and the mindset that we have has a huge difference. We've had great conversations about compassionate accountability and the realizations of what homelessness entails and what that means on a very personal level and the realities of that. And I would just say that our task force and city council is very diverse in those opinions, and we've had very robust conversations. But I appreciate your words, and I do echo those to city council, and I wish that more of those opinions and viewpoints were echoed at the city council level and not just at the task force level.
I think we'll end public comments on that note. Chief Johns, did you have something you wanted to say?
So I did want to address that we have addressed camping, established camps, and we've addressed behavior. So what that means is if we get a report down at Riverfront of tents, we go down, we establish if it's simply there a short time, if it's got trash around it, if it's becoming an established camp, then we post it and we go back and address it if it's still there and it's not moved. So I personally have hiked into Riverfront Park multiple times. I was out of town this last week, so I wasn't back in there this last week, but we can only do as well as what we have information on. And I will say I've personally cleaned out the trash and the what has been left behind after we've posted. So I'm not sending people in that I can't say I haven't done myself. But the other part of that is I can't go to someone that's at Pioneer Park because I think they're unsightly laying on a sleeping bag and tell them to move and infringe on their constitutional rights, as opposed to the guy that's laying on a beach towel with the tropical fish. It's like they each have their right to be there in the park, and they, even under the new ordinance, will continue to have that right. But what we're talking about is camping. We're talking about established camps. And then also we deal with ordinance and law and, like I say, behavior. So when we're at Pioneer Park, there's someone that's drinking, creating disturbances, those sort of issues. We address those. In the last couple of weeks, we've been addressing the behavior and doing park exclusions. So as we get reports, and that's to Julia's point, like we can only deal with what we know, and we've got a whole lot of other calls for service that we address in addition to these. So the citizens' eyes and ears are helpful to us. And then again, there are things that we can do. And to the point of our guest speakers tonight is the issue isn't just the homelessness issue. It's the mental health, the drugs and alcohol. And it's a much larger long-term issue. And for as much as we can, we resource with SIT. SIT has been amazing to us. We've seen personal success stories of people that are long-term homeless that are now in homes and safe. And so it's not an easy fix. It's not a short-term fix. The one individual, literally, it was a 2.5-year process. And the day that we saw her go into a hospital setting and get mental health treatment, there was a team of 12 of us at the park. It wasn't a great day, but the outcome was great. And, we've had successes. So I appreciate the teamwork and the continued teamwork with the problem solving.
Thank you, Chief, and thanks for that clarification. Yeah, and I will just reiterate, I think everybody, the city staff, the task force, the council, the community members, the nonprofits that are, supporting, we all want the same end result, which is people to have a safe, stable place to live and not be out on the streets. There's divergent opinions on how you get there and what that looks like, but we all want the same thing, and we're all doing the best that we can to get there. And it's going to take continued community and conversation. And it's wonderful that we have more people involved. So I'll just leave that there for now. Next steps, your next meeting is September 11th. And I'm kind of working on a draft based on what we've heard over the last few meetings, public input, the information that we have, what you guys have said, you're kind of wanting to hear more from. I'm drafting some questions for that next community survey. And I think it's going to be, that the first survey was, how do you feel about homelessness? What do you think? What are your issues? What are your concerns? And this one is going to be a little bit more specific about trade-offs, residential, commercial, site-specific, hours, those types of things. And so hopefully, especially with this added influx of interest and involvement, we'll get even more information that will guide some refinements that will be better. So that's what the next step is in the process.
Question.
Yes.
What is our timeline for our next recommendation to try to narrow this?
Yeah, if we can get some, depends on whether or not you guys have a lot of comments on this draft survey. So what I was thinking is that, so the next meeting, September, if I get some good comments on the draft survey at the September, we could potentially release it late September and have, at least 2 weeks, if not a month of input. So that's, if we get it mid-October, analyze the results, probably November, share it with you, and then kind of feel you guys out on whether or not that's enough. We've got now a lot more people interested, see kind of how we want to share that. If you want to have an initial recommendation that you get some input on. So I'm hoping by December, maybe January, you could have a revised recommendation or an updated recommendation. Again, that's going to be a little bit dependent on you now and whether or not you need more information, and the public, and whether or not they need more time to give you information. And that all said, so while December feels like a long time away, it's not. But if there are issues, the police will address issues, contact the city if there are concerns, and we will be prepared to pivot if we need to and do things differently or quicker. But that's the plan right now. Questions? Okay. That's it. You guys did good. Thank you.